going to take your blood pressure.
California is facing a catastrophic healthcare worker shortage, and it will only get worse if we don't act now.
The state will need approximately 240,000 RNs by 2014.
That's why the Speaker of the California State Assembly, John Pérez, authored Assembly Bill 2385. If passed, AB 2385 would fast-track California students into community college nursing programs. The bill's co-author, Assemblymember Joan Buchanan, knows that will help alleviate the healthcare worker shortage.
We know that the only area that we're not losing jobs in California, one of the only areas, is the healthcare profession. So what this bill does is, one, it allows us to look forward and to do some real planning so that we avoid even more severe shortages in the future. Two, it invests in our own people in California.
AB 2385 would do this by creating a pilot program at 5 community colleges throughout California that would accelerate the nursing curriculum and get those nurses out into the workforce.
The goal of the accelerated program would be to allow students to attend full-time and earn their degrees sooner. The pilot program envisioned by this bill will provide accelerated learning in a variety of formats and services to facilitate student completion of the programs in 18 months or 3 semesters or less.
Go ahead, open up.
Community colleges train 70% of the nurses in California, but are so overcrowded and strapped by budget cuts that qualified students who want careers in the healthcare field are regularly turned away.
I have a constituent in Elk Grove who has applied to the community college nursing program 3 years in a row and has lost the lottery all 3 years. She's one of our residents in California who wants a career in nursing.
And there are plenty of jobs to be filled as the baby boomers in the healthcare industry are retiring. Boomers are growing older, needing increased medical care themselves, and California's growing population also continues to increase the demand for more nurses and other healthcare workers. However, right now, there aren't enough Californians trained to fill those jobs.
So what are we doing? We're bringing in nurses from other states and other countries when we have 12.6% unemployment in California and when our own people want to fill these jobs.
The healthcare worker shortage will continue to grow if we don't act now. AB 2385 is one way we can educate and employ Californians in good-paying jobs while putting a dent in our nursing shortage. This report was produced by the Speaker's Office of Member Services.